And welcome to day 4 of our special joint podcast with the Global Health Council, coming and a shot in the art podcast, obviously. And I'm joined, of course, by my co-host with the most, Elisha Georges.
We're really losing it on day 4.
We are. Heaven help us tomorrow on day 5. Elisha, how are you doing?
I'm hanging in there. I have a little bit of jet lag. Been running up and down the hills of Geneva, but other than that, I'm good. How are you doing?
Sounds very Sound of Music. I'm I am now truly reliant on the 3 C's: coffee, carbs, and cocktails.
Yes. Ooh, good one. Better than the other 3 C's.
Yeah. So who are we joined by today?
So today we're very happy to be joined by Bukola Shaba, who is the communication specialist at the Health System Strengthening NGO Salina, and also a trustee of Women in Global Health's Nigeria chapter. Welcome.
Thank you so much.
And also Crystal Lander, who is the Chief Strategic Engagement Officer with Pathfinder International, as well as, more recently, the chair of the Frontline Health Workers Coalition.
Hey, nice to be here.
So, you obviously both have a lot of healthcare and health worker experience. So we're going to talk about that today. And why don't we kick off by just a little background? Why is this an important conversation? Bukola.
Okay. I wasn't sure. Thank you, Elisha. Wow. Well, where do we even start? You know, health affects all of us, every single one of us, in every population, in every country. So it's a very important conversation. And for me, you know, sitting here in Geneva or being here at the World Health Assembly, it's really about ensuring that the gender lens is a part of that conversation as we discuss, you know, universal health coverage, pandemic preparedness. Health workers are at the forefront of that. And we must also, you know, ensure that, you know, female health workers particularly sometimes would have unique challenges, and those must be a part of the conversation as well. To remuneration, I mean, the issues are a lot. I'm sure we'll get to it at some point, but I guess for me, one of the important things is just to ensure that we're bringing in that gender lens as we talk about the issues that affect health workers.
Because we saw in COVID that women healthcare workers were really on the front line,
Yes.
Nurses, but also physicians, and of course, community health workers.
Yeah, absolutely.
Yeah.
Crystal, what do you think?
For me and Pathfinder, is 2 major reasons why we think it's important. One is we are leading up to universal high-level meeting on universal healthcare, and we know that now this gathering of ministers of health and civil society, private sector, this is maybe our last chance effort to really influence them on ensuring that we are still moving toward progress. To be perfectly honest, COVID set us back, but you know, the women, children, communities can't wait. We still have to keep things going, and particularly we know that healthcare is not delivered by anyone else but health workers. So whether it's community health workers, physicians, laboratory assistants, doctors, nurses, we need them, and we need to make sure they're championed, they're supported. And as Bukola said, it's important that the policies match the ideas, and the money goes where the policies go. So it's something that it constantly has to keep happening. And so WHA is a great time to gather folks together and start talking about these things and set the things in place so that governments around the world are held accountable, to be perfectly honest.
Can I just ask you, you said this is our last chance.
Oh, yeah.
What do you mean by that?
So there are a couple things simultaneously happening, we know, policy-wise. So this high-level meeting in September, that'll happen in New York on a number of issues, but particularly on universal health coverage, it'll be a check-in. And so one of the things is a few years ago, we had this, countries came together and everyone made a commitment. And the reason why this is important is because it's a rare time where countries come together and say, we all are going to agree on a way forward. We saw this happen in the Millennium Development Goals and Now we see it happening, moving forward for this. And universal health coverage is how country governments around the world have set forth their budgets, also their policy. Where the standard is, we believe that healthcare should be for everyone in our country. Therefore, the how do we get there, is the pieces of the puzzle. And so holding them accountable, and a big piece of how we're going to get there is looking at the health workforce in countries. And so while, again, it's wonderful to keep stating the facts, and we know the facts, the reality is that we got to get to some action, because we can't keep saying, well, COVID moved us back. Okay, we heard that. Again, we still have other things to do. Pathfinder is extremely focused on making sure health services are delivered. Reproductive health services are particularly delivered to women, and they continue. We know maternal health care is important, and they happen whether there's a COVID, there's a flood, there is a earthquake, there is a humanitarian crisis. These things all still matter. So we have to equip and support health workers so that they can do this work, be it through digital technology, direct care, and kind of in emergency settings. These things have to be taken into account, and we have to put forth. And so we know that country governments get this. What we're trying to say is, okay, now get into the how. Where are we going to get the resources? Where are we going to get the equipment and the support to move things further along the line?
So can I ask you, I mean, you said it's the last chance, and this week I keep hearing everybody say, this is the perfect time to transform global health. We have all these pandemic pieces moving. We have the Accord. We have the health regulation revisions. We have the pandemic, high-level political resolution.
Mm-hmm.
We also have the WHC resolution in the fall. But WHA itself is moving at what I feel is a glacial pace. Universal health coverage was supposed to be on day 1. We're now on day 4, and we still have not gotten to it.
And they didn't close shop till 2 o'clock this morning.
Right. So it's not unusual for WHO's agenda to go off the rails. But what, Bukola and Crystal, what do you hope to see happen when the UHC parts get to the floor of the Palais?
Yeah, I think for us, right, and there was a round table yesterday, so I think the conversation already sort of started in pockets, and of course a lot of side events going on. But when it does get to the floor, for us at Women in Global Health, we just want to ensure that some of those papers and things that we've contributed to and put forward would actually be heard, and commitments will be made. On the one hand, we are calling for better remuneration of health workers, especially at the community level, because they are the ones who are doing the brunt work. Also, we want to see more representation of women. At the global level, we're seeing that in some cases, up to 90% of healthcare workers are women, but when you look at who is making the decision, who is in the room when things are happening, these women are not there. So we want, that, again, that gender lens for them to acknowledge the importance of having women in the room, because women, we are qualified to have those conversations, to be a part of that. So those are issues that I want to bring to the fore. And also, we want healthcare workers need to be protected. There's a lot of harassment that goes on. There's a lot of, in some cases, even stigmatization, right? We saw that a lot during the pandemic. So somebody gets COVID, and there is not enough information, to understand what's going on. And so those people are stigmatized, healthcare workers within their own communities, right? So all of those kinds of issues can be averted, right, if information goes out. So we want all of those. Those are some of the issues that we're hoping will be deliberated on, and governments will commit. And actually, beyond the commitment, like she was saying, action, right? That's really what we need. We can talk all day long, but if there's no real action, like I was just coming from another side event where somebody was saying they wish the ministers of finance will be a part of some of these conversations, right? Because when you talk about remuneration, for instance, we can only say, yeah, we need healthcare workers to be paid, but the finance people also need to be a part. So it's a huge thing. Yeah, and I hope I've not gone off the rails too much.
No, you didn't.
No, not at all. And
no.
so I guess it's a question picking up on that. Are you pushing at an open door, or are you finding opposition by the decision makers here to having leadership of and by women in these discussions?
My experience is no. So everyone on paper says the right things, and everyone gets it. I mean, Minister Tedros, not minister anymore, sorry, Director General Tedros, he started from the top at the round table yesterday, which was fantastic. He said, "Look, we all know, everyone agrees that this is a good thing. We now have to do it." And I think that's the frustration, is that we have been talking and talking and talking, and everyone gets it, but when it comes down to the action, you come year after year and you don't necessarily see a lot of change. You see a few more women in the room, but not nearly where it should be. And then I think we have to look at why. And so getting women in the room and not supporting them, or frankly not creating environments where they can do the job safely and supportedly, is the reason why some of them leave. And so it's the same thing with health workers. They're not supported. And we had, a whole dialogue. Women in Global Health actually on North America hosted an event recently where it was the first time we really talked about why there are not more women going into public health careers. And we talked about the full range of healthcare careers, and not just in the rest, Asia, Africa, and low and middle income countries. We talked about in the United States and Canada, which I thought was really powerful, because it's the first time someone said, well, one is, who can encourage someone to take on that kind of debt? Secondly is, if you do take on that debt, if you want to work it off, you go someplace that may not be safe to work in or may not be supported. You talk about people of color in the United States. There's certain places I can't go very safely. I'm just going to be honest. But when you heard, I think it was someone from Thailand. I think it was it was another person who said it yesterday at the roundtable. They said, I would not encourage someone to go into a healthcare career at this point. They were like, they're harassed, sexually harassed. They are bullied. They are put in positions where they're not safe in working in the hours. So we have to start looking at not only getting more women in the room, but supporting them once they get there, and looking down the pipeline of why more women are not coming into these careers and staying. And I think that is something that maybe needs to be talked about a lot more.
Agreed.
I just want to highlight too that we are saying women, plural. That it's not getting one woman into the room. It's
No.
multiple women, and not just into the room, but making decisions in the room.
Yeah, no figureheads, no photo ops,
No
tokenization.
Yeah.
And they have to have the power. So again, getting women in the room, like you said, but they have the power to make decisions, and power comes with money.
Yeah.
So they have to be able to have some ownership over budgets. Right. And we know that where budgets, there's power, because other than that, it is just tokenism.
Right. And Bukola, what's your sense coming from West Africa, and particularly Nigeria, the most populous country on the continent? Does this resonate?
Oh, very much so. I mean, where do we start? Because we have, a lot of other things that sort of come into the conversation for us. You start to look at issues like religion and culture. And so those things even further set us back sometimes as women. So we might not have the issues of debt, going to school, but in certain regions, you find that girls are not going to school the way the boys are, right? So it might be slightly different from like the Western societies, but we have the issues. So I can definitely relate to some of that. The harassment, the sexual harassment I can't even start to, even in the most civilized spaces, sometimes women are just not safe. And we find that is lack of information on the one hand. Some men don't even know when they're doing it, unfortunately. So there's the education part of it, but there's also the part where, if it does happen, do I have agency? Is somebody going to listen to me? Is there a law in place that ensures that other people are deterred from doing this? So all of those issues, right, are the things that we hope that our governments, and leaders and can start to, make resolutions on and actually do the work. And of course, we also, like she was saying, if more women are in the room with the power to make decisions, then they're able to bring in the holistic perspective. I heard Dr. Ayuade Alakija, who, I heard her speak the other day, and she was giving this powerful example of building shelter, I think it was shelters in a certain community. I think that they had a disaster, a humanitarian disaster, and they were building it so close to the bush. But they didn't realize it because it was all men making the decision, and they were thinking, let's just build shelters, let's ensure that these people are safe. But they didn't realize that by building it so close to the bush, then it gave some, people the opportunity to rape women as they were going to the bathrooms, right? If a woman was there, she's able to say, wait a minute, let's move it closer to where, something like that. So yeah, it's really important, and I can relate. Yeah.
Can I ask a follow-on about that? Because we talk often about rape and sexual assault as a physical issue, but of course there's a mental health component attached to that. And I think over the past several years through COVID, we've really seen the stress and the toll that all of the caregiving has taken on women, but certainly women healthcare workers in particular. And Crystal, when you say support for women in the space or healthcare workers, regardless of gender, are we also talking about mental health support, well-being services? What does that look like in the work of Pathfinder and Women in Global Health?
Yeah, and I think Pathfinder even started to think about it with, not only with staff, but with on our projects, it's thinking about where we're working and was that included before? And should it be? And how do you do this where it's integrated in? Because sometimes you have to be the partner who says to the government, hey, we need to consider this. And I would say not the only, but one of the real positive things coming out of COVID is it felt more free. People talking about, I'm exhausted, I am stressed, I need help. And it felt more universal than I felt like it's ever done before. It shouldn't have had to take to that point. But sadly, you had health workers saying, enough is enough. I'm working so many hours, and people finally saying, okay, I understand that. Yeah, this is unreasonable. I just don't think that lens was on there, that level of kind of knowledge. And then people were listening. And so now it feels much more normal to say, hey, you know what? You need to take that time. Now, we used to always joke, this is a bad joke, but in the United States, people don't, you save up vacation time. You can see it was a contest to see who could have the most at the end of the year. And now that isn't. People are like, why haven't you taken your vacation time? And then looking at, many of the projects we're working on and in the communities where we work, you're saying, hey, there's no prize for working around the clock. And these are not good things. And please take time off. And you seem stressed. And what about, so everybody in every level down paying more attention to what things look like rather than just, really rewarding a culture of overstressed, overwork. And that's nice to see. I will also say very strongly that I'm extremely proud to work at an organization that stands up against sexual harassment and says that it will not be tolerated in our workplace, regardless of local customs and culture. We recognize that it may or may not be legal in certain countries, but may or may not be enforced in certain countries. But for us, it was really important that we take a stance on these issues and we're very clear on them, even when it goes against maybe local custom, which we try to support and follow where appropriate. But those are some of the things that that's where you have to push back, to be perfectly honest, and stand up for your beliefs.
I want to ask a slightly naive question, as I suppose the only man on this panel, which is how it should be.
Yeah.
But I wonder if we're sort of caught really in a double whammy or two horns of the dilemma, because healthcare workers are not supposed to have mental health issues. It's supposed to be solid. We can always rely on you. And the other part of the horn, if you like, the other part of the dilemma is that women in healthcare, particularly nurses, well, you're implementers. You're not the great thinkers with the bow ties. And isn't it funny, whatever country,
Yeah.
senior physicians, surgeons, and others have bow ties. I don't know what it is. Well, it's the surgery thing, isn't it? But anyway, but that sense that, you're just frontline workers. Yeah. And I really wonder if COVID is forcing us to sort of ripping the bandage off on this.
And humanizing. I think humanizing. I think, again, It was a shame that so many health workers were like, one, dying,
Mm.
two, being like, enough is enough and quitting. And then but it goes back to, if it doesn't affect me, maybe I don't know. So then it was affecting people. People were like, well, wait, my doctor's quitting. And then all of a sudden it was like, well, oh, my doctor is not available. My doctor said that they are taking no more patients. Then all of a sudden maybe it got real for people. I hate that it got like that. But I do think, unfortunately, until it touches sometimes people, they don't think it's real, even though it's been happening and happening. We've been talking about this stuff for so many years, but
Is you're finding the same in Nigeria? I think in the US we have made some progress in being open about talking about mental health issues, not in every community, not in every demographic, but you see ads on TV for therapists and you hear celebrities talking about their therapy experiences. Is that translating, or is there still a tremendous amount of stigma around it?
I think we've moved a little bit forward, right? Again, when these conversations are happening at the global level, it sort of trickles down, right? So every other nation starts to pick up on it. So it's coming, and the conversations are gradually happening. I think for the most part, a lot of people still don't get it. Even the people that need it. So you're saying you can take a break, and they're like, how can I do it? Like, they don't understand. And as she was talking, and I do agree with a lot of the things, but I just kept thinking it's bigger, because now what we are facing, apart from the resignations that are just huge, is the migration in Nigeria, in Africa. A lot of people are moving to Western countries because of remuneration problems. For some people, it's security. It's a lot of issues that are making these health workers leave our country. And what then that means is that where you would have, I don't know the accurate data, but just for example, one doctor to 500 patients, you're getting 1 to 1,000 now. I mean, that's just ridiculous. That's an impossible situation, which then means we need more nurses, we need more community health workers, but even they are leaving, right? So there is the part where at the more strategic level, the governments need to do something, right? To either to train faster, so that more people get into the workforce, because I don't think you can stop your citizens from migrating, but there's got to be a trade-off, so if the UK, which is where a lot of our doctors are going, if they're absorbing those many doctors, then what are you giving us in return? So but mental health, yeah. So I feel like that then affects the mental health conversation, because there's already a shortage. And so the people that are left are forced to work twice as hard to be able to catch up with what the citizens need. And so it's a little more difficult, but I think gradually the conversation is getting a little bit more open.
Yeah.
Can I just touch on the migration in the doctors? Because this came up in the roundtable meeting the other day, and I thought was really powerful. There are two major things that came up that I thought were rarely said publicly, which is, I think this is where Thailand spoke and said, let's call it what it is. It's colonialism when you are taking doctors from low-income countries and you literally are giving them more money. And of course they're going to move there. Like, people need money to survive, and they need it for their families and everything else. So you're creating opportunities where we're training and you're taking. And I thought that was brave to say, and it's honest, and it's something we all have to do. There are shortages everywhere, but countries that have more higher incomes cannot do that, because you're creating another problem on the other end. And then the other part of it is training. I think that whole idea of training faster and creating more medical schools, more public health schools on the continent, if we're talking about the continent, on the continent. Because once someone moves to the UK, we all know wherever you went to school, probably you stay there. I mean, that's pretty much people all over the world. So the likelihood, the member state from Papua New Guinea was like, yeah, so good luck getting a person back to Papua New Guinea, where they have rural community and everything else, and they now have had a taste of this other life. They're like, we gotta train faster, but keep them. And so I love the fact that they were thinking, how do we keep them? Now there's some short and long-term solutions, but that was the progress and the action that I have not heard talked about very often. And we need more investments in those local, we're talking about local solutions. That's a local solution. We need a medical school here, a nursing school here. We can train up quickly and keep going, not send everyone overseas to get training to bring them back.
I think too, there's another piece of that, which is a burden that high income countries have failed to address, that we don't treat our health workers well enough to incentivize people already living in the country to want to pursue that profession.
Yeah.
So we have our own shortage.
Yeah.
And then instead of fixing exactly what you're saying, like building more training places that are accessible to a range of communities, creating supportive work environments, safe work environments, our solution is just what we do for many things in the US, outsource it and bring it we'll just find a cheaper way to address the problem that's in front of us and not fix the system. But if high income countries really thought about the wages that we pay health workers, the working environments for health workers, we would have a more of an incentive for new generations of health workers to come into the fore, and we wouldn't have this shortage.
I'm struck by a comment you made, Bukola, about Nigerian health professionals being recruited in the United Kingdom. And what do they get back? I mean, two things immediately strike me. One, that in itself is a much bigger question, given that Nigeria was a colony of the UK, and broader reparations. I mean, you're still seeing this neo-colonialism of people being moved into the National Health Service. And it is interesting, isn't it, that the one region, when it comes post-COVID, to looking at the appalling lack of equity around vaccine production and manufacture in the region, close to home, that it is Africa that is making so much progress, thinking through how it needs to do that. And so I take your point absolutely, that part of that conversation also has to be medical schools, nursing schools, and ongoing clinical medical education for these folks with proper remuneration. And so I wonder, as we get sort of into the final leg of this podcast, we've talked a lot about the problems and talked about the need for more than tokenism. So what should our demands be? What should we expect, not only the WHA, but our countries and then our local health authorities? What should they be doing? And I was looking straight at you.
We all looked at you.
We're like,
Ooh, okay. Yes. So I'll start with the Women in Global Health bit, right? Which is what we're demanding, is that gender equity across board. So whether we're discussing training and other things for ensuring that health workers have everything that they need, we need the decision makers to be thinking about who they are servicing, so to speak, right? So it can't be just too broad a solution. It's got to be, if we're addressing women, are we putting everything in place to ensure that the female health workers get what they need? And of course, I would also say to the government, that one is huge, because they have the power, and like she was saying, without money sometimes there is no power. And I don't know if I can say this, but sometimes I empathize with the governments, because they're people too who sit on those positions, and I can imagine how difficult a decision it must be sometimes. But I think thankfully, we're starting to get individuals who have some level of integrity, who can say openly that there is a problem, right? Even though it's affecting my country and I'm a leader there, I acknowledge that it's a problem. And I think that that's a step, that's a right step. When you acknowledge that, when you're not too proud to say, well, I can't control this, right? And then it helps you to then make the right demands. So I think the government also need to step up and speak up about those issues. So if this and I hear of some treaty that WHO had put in place around the migration issue, just to ensure that there's a trade-off. The governments just need to keep demanding, for those trade-offs to actually happen. If you're going to take this many people, what are you giving me back? And so those conversations, I would say, that need to be encouraged more. And I'll just stop there, and Krista, I might come back.
Yeah. The first thing, so a couple of things. So with my U.S. hat on, I want my government to follow its true principles and be a good player in the rest of the world, be a good supporter in the world. And that means that we should, and I strongly advocate for foreign assistance from my government. I want them to step up. They have greatly benefited from a number of things around the world. Therefore, it's our moral obligation to give back. So to me, that they should do that, and with flexibility through our foreign service to allow governments to follow government plans to support those things. And I think there are plenty of things in place to support that tracking of foreign assistance and tax dollars well into supporting other governments in their plans. So that's with my US hat on. For other country governments, I want them to remember their plan. Many of them have health plans. I want them to remember them and keep them focused. And take a look at those plans. If you don't have gender equity issues, parity and equity issues in there, you need to revise it. If you don't have a real plan around how you're going to recruit a health workforce, you need to look at it. You have almost every country we're talking about around the world has a population of young people that is skyrocketing. The reality is that they need jobs. So we need to be creative and think through, do we need to train them to be the generation of health workforce for the future? And if not, why not? We need a plan B here, and it's coming up really quickly. So I want them to think more creatively about how we do this. We talked about the finance ministers earlier too. Finance ministers tend to run in a different circle, and I get it. It's very hard. If everyone comes to you saying, here's a laundry list of things to pay for, it's very difficult because there is finite pieces of money. But I think work with ministers of health so that you have a game plan together. Some of it may be, every country is not the same, and we recognize that. Some are very low resources that have a lot more challenges than others. And so I think when we're talking about scale and looking at this, every country's plan is going to be different, and that is okay. But I think for the countries where they can do more, we expect more. They should be putting more in the domestic resources for health, and the expectations that they will do that. So I'm ready, like Dr. Tedros said, I'm ready for more action. I'm ready for more solutions to the problems. We are done just stating the numbers anymore. We know it. Let's move. Let's see some things in September, to be perfectly honest.
Yeah.
Get back on track.
I just want to add one more thing, because I'm thinking of that one person who is watching this and thinking, what can I do?
Mm-hmm.
You're speaking to the government, you're speaking to the leadership at WHO, but what can I do? I think you can advocate. I think you can write a tweet, do a post, join us to talk about these issues. And the more of us talking about it, the more pressure on the people that can make a difference and actually change it. So I think, we all have that tool to advocate for these issues around having gender equity, across board, and all the other issues that we're asking for. Yeah.
I would also just say, if you're an individual, you can be nice to your healthcare worker.
Oh,
Yes.
Like very basics. I mean,
Humanize them. Yes.
like a healthcare worker, just like the government official, you're so nice to be empathetic to them, is a person. Right?
Imagine that.
It's a woman, and often a woman, often with children, often with family responsibilities, other economic issues, living in the same community that you're living in. So be nice. Say thank you. Say hello.
That's a good point.
be such
We
a
all thought
grouch.
thanked them during COVID, but it's like they still do this work
Yeah.
every day after COVID.
Well,
So,
we
yeah.
know we all go to the doctor and we're all grumpy because we don't feel good, but try and, be pleasant. Be your best
Good
self.
point. Be your best
Healthcare
self.
provider.
Anyway.
Well, I think that's a really nice way
Yeah.
of bringing this episode to a close. Crystal,
Yeah.
thank you so much for being with us.
I am so pleased to be invited.
And you are an alumni of A Shot in the Arm podcast. You
I
were
know.
on with Frontline AIDS last year, I think.
I think so. So check that out. That archive.
And Bukola, what a real honor to meet you. And looking forward to, let's hope we can have you back on the show. And particularly when we're in Nigeria later this year, perhaps we can
Nice.
Connect.
do
Yes,
some work
good.
together. Yeah.
Okay.
Let's do that. Yes. Thank you.
And as always,
Thank you, Ben.
Y'all should take road show. Y'all should just do this on a road show together.
Don't give him any ideas. This is the road show.
It's the road show. Yeah. No, but it's really fun, and I hope I am not intruding too much.
Oh, no,
on the
it's been
really
really
important work that you are doing here.
Oh no, it's been great. I mean, I know we're all running, as she was saying, like running up the hill, running down the hill. So there's plenty of activities going on. I know Women Global Health has a reception tonight.
Yeah.
We do
Crystal,
at 6.
right? Pathfinder and GHC and Frontline Health Workers and Living Goods did one last night. So there's, we're making time for all of the things. And luckily, everything is moving so slowly in the Palais.
Get back in
You
time.
can like just check it. It's like a soap opera, like every episode just inches
Stay
along.
tuned for another world.
Yeah. And isn't it funny that what really slowed things down this morning were two competing resolutions?
Yes.
We had the Russians, your friends, coming back at us and saying, respect our sovereignty.
Right.
That sank faster than the Titanic.
Absolutely,
Yeah.
as it should have.
And then we had Ukraine with this very interesting resolution supported by the States and the Europeans around really criticizing the targeting of healthcare
right,
in war,
the
which I thought was,
weaponization of healthcare systems by Russia. Yeah, which passed with
Yeah.
So
was adopted. Yeah.
a lot to do. Well, great. Well, that's it for this episode. Thank you again to my host and our guests. We'll be back tomorrow with, I guess, our last.
From Geneva, last one.
Yeah, and we may well have cocktails in front of us. Who knows?
I think we're recording at 11 in the morning, so perhaps
We might
not.
well have cocktails.
It's 5 p.m. somewhere. Isn't it?
That is true. That is true.
Okay, everyone. Well, have a wonderful day, and we'll be back tomorrow.